Welcome back to the Deep Dive. I'm your host, and today we're taking a look at something so common you probably don't even register it anymore.
Yeah, I'm thrilled to be here as your resident medical expert for this one because we are unpacking a really critical topic.
Right, so picture a hospital room. You've got the uncomfortable bed, the monitors beeping, and, hanging on that silver pole next to the bed, the IV drip.
It's basically the universal background prop for any medical scene ever filmed.
Exactly. And I'll be honest, before we started prepping for this deep dive, my assumption was pretty basic. I just thought, oh, the patient is thirsty, they can't drink, so the doctors are just bypassing the mouth and giving them water.
Which is a supernatural assumption. I
Yeah.
mean, it looks exactly like water. It flows like water. But if you walk away with one single thing today, it needs to be this. Agi therapy is absolutely not just giving water.
Yeah, we are going to completely shatter that assumption today. We've been diving deep into a really fascinating medical text, Practical Guidelines on Fluid Therapy by Dr. Sanjay Pandya. And let me tell you, I walked away from this realizing that prescribing fluids is, well, the high-stakes game of chemical chess.
That is a fantastic way to frame it because the reality of clinical medicine is that if you choose the wrong fluid or the wrong speed or, the wrong volume, you aren't just failing to hydrate someone. You could actually be prescribing a lethal drug.
Which is a terrifying thought for the average person. The source text actually compares hanging an IV bag to prescribing powerful intravenous antibiotics or heart medication. It requires exactly that same level of mathematical precision.
Absolutely. You wouldn't just grab a handful of random pills and hand them to a patient just because they look like medicine, right?
Right.
So you shouldn't just hang a bag of fluid because it looks clear and wet.
So our mission today is to decode this menu of IV fluids. We're going to figure out how doctors actually know which bag to grab from the supply room. We're going to map out the human body's internal oceans. And yes, I've been warned we are going to do a little bit of math.
It's survival math, though. I promise it's the good kind of math.
I will take your word for that. So let's start with the container itself, the human body. We always hear that cliche, humans are mostly water. Is that actually biologically true, or is it just something they print on the side of expensive water bottles?
No, it is true, but the nuance is what actually matters for a doctor. If you look at a typical young adult male, total body water is about 60% of their body weight. So if you weigh 70 kilos, roughly 42 liters of you is just sloshing water.
Wow, 42 liters. That is a lot of heavy lifting.
It is, but, and this is a really interesting physiological point, for females, it's usually closer to 50%.
Okay, why the sudden drop?
It all comes down to body composition. So adipose tissue, which is fat, is hydrophobic. It hates water. It doesn't hold on to it at all. Muscle, on the other hand, holds a ton of water. And generally speaking, women naturally have a higher percentage of adipose tissue than men, so proportionately, they have less total body water.
Oh, that makes sense. So paradoxically, an obese person actually has a lower percentage of body water than a very lean person of the exact same weight.
Exactly. The fat physically displaces the water. And then if you look at the complete opposite end of the spectrum, newborn babies.
Right, they're always so squishy.
Yeah, because they are roughly 80% water. They're basically little biological water balloons.
Note to self, handle babies with extreme care. Okay, so we are essentially giant bags of water, but it's not just one big open tank sloshing around inside us, right? Like if I drank a big glass of water right now, it doesn't just pool around my ankles.
Thankfully, no, it doesn't. And this right here is the fundamental concept of all fluid therapy. We have compartments. The big major division is between what's inside your cells and what's outside your cells. We call this intracellular fluid, or ICF, and extracellular fluid, the ECF.
And Dr. Pandya breaks this down with some very specific fractions in the text.
He does. The easiest way to think about it is that 2/3 of your total water is hiding away inside your cells. That's the ICF. It's locked inside the microscopic furniture of the house, so to speak. Only 1/3 is outside the cells in the ECF.
Okay, so the vast majority of my water is essentially structural. It's inside the cells.
Mm.
But here's where the text got a little tricky for me. That